media hero, a badass author, an award-winning writer, and a national healthcare advocate.
Hi, United Healthcare. My name is Jen, and I come from Manchester, New Hampshire. I have United Healthcare Medicare Advantage, a privatized Medicare plan. We need to talk about our relationship and the way you treat good people. I and others like me are relegated to suffer and die at the hands of our health insurance. I'm sick of losing my friends. I've spent the last year begging you for a $600 infusion to treat the most painful disease known to modern medicine, CRPS, complex regional pain syndrome, the suicide disease. Let me tell you, a year ago while United Healthcare was celebrating over $8 billion in first quarter profits, I was selling the last of my belongings that had any value. Collect Medicare premiums and overpayments to the tune of $140 billion in profit, only to be discampaign last year, and I put my life on display in hopes of getting permission from United Healthcare to stay alive. How can you sit there? How do you look in the mirror? Petition to shame United Healthcare, and it worked. They contacted me on Twitter and said they would cover my infusions. How do you give a ketamine infusion without saline? Yes, too. These are the things you ignored. Can you hear me in there? I took that message to Washington, D.C., and I traveled from my home in New Hampshire to my federal delegation, Senator Shaheen and Senator Hassan. United Healthcare only noticed when the senators filed a complaint with CMS. Only then did United Healthcare approve my ketamine infusion and the tools to administer it. It took from April to July to get permission to save me from a nightmarish decline into a fate worse than death. Prior authorizations, the so-called gold standard, to make sure I don't use too much health care. Are you shitting me? Prior authorizations don't make care better, they delay it. Prior authorizations deny care. Prior authorizations kill people. Prior authorizations are not worth the paper they're written on. I've since had to go back to my senators. I was able to access another ketamine infusion in November. United Healthcare gave me permission to be treated and then took a walk as soon as the bill hit, complaining my doctor wasn't in their network. They settled the claim for $1.22. So I appealed that, and they reprocessed the claim for $1.01. They went down. They told CMS to let my senators know the claim was paid at the negotiated rate. Are you kidding me? How the hell does my doctor keep providing life-saving care if he's not paid? What is that? Are you trying to buy another practice or just kill more of us off? So my senators had to file complaints with CMS again and United Healthcare to pay my doctor. And finally, just a few weeks ago, they paid the November infusion. Now I wait to see what happens with the March ketamine infusion I just had, and how many hours and days and months it will take to ensure my provider can keep the lights on. Your executive office contacted my primary, asking for a referral to a doctor you picked for me. A doctor who's retired at a clinic that closed in 2019. I have an email from my primary asking me about the requested referral, a referral that United Healthcare initiated rather than pay my doctor. If they can't starve our doctors into contracting with them for ridiculously low reimbursement rates, they'll kill me off by sending me to a non-existent clinic. Seriously, you couldn't even pick up the phone to find out if where you wanted to send me even existed. Prior authorizations keep me alive? Bullshit! I've shared my story with the White House, and I've been to every possible place to meet and talk to United Healthcare. Now I'm standing in your lobby. Do you hear me now? I don't want to die. Do you hear me, United Healthcare? This is one of my denials.